with all the different pelvic floor issues, we want to kind of start at that foundational level. So it's kind of like before we address any of those, I it's very important for my clients and just everyone in general to start with this foundation before we can add on or go to different ways for the diagnosis, because these are such a foundational level to keep your pelvic floor nice and healthy. So let's talk about the first one. As humans, we hold tension or stress or anxiety in the body, and sometimes, a lot of times we don't know, but we have a habit of where we hold it. So it's common to either hold our stress or anxiety in our jaw, in our upper traps, in our stomach or pelvic floor, or in our glutes, like we'll squeeze our glutes. And there's occasionally also like toe grabbers. Typically my toe grabbers have more plantar fasciitis issues, but if you are known to hold stress, carry stress on your shoulders or jaw, you most likely are carrying it in your pelvic floor as well. So I would say the first homework assignment is, throughout tomorrow, we'll do like the whole day, like just be aware of, am I holding tension anywhere in my body? And if so, where, and like what posture am I in? Am I sitting? Am I standing? And what emotion am I in? Am I at work? So kind of like start seeing certain patterns and awareness with where you're carrying it in your body. Are you relaxing your stomach when you're relaxed, when you're sitting or standing, or are you still holding and tightening it? And then the next one is belly breathing. So kind of going back to the pressure, I want you to think of your diaphragm and your pelvic floor like a piston. So moving in the same direction, up and down together. So when we inhale, remember, air comes into our lungs. So our lungs need room to expand. So it pushes down, and then that pushes our pelvic floor down. That's the optimal time where we want to kind of relax, or even we'll, do some stretches in that inhale. Now, when we exhale, the air comes out. So our diaphragm comes back up and our pelvic floor comes up. And that's the best time to contract and do like the different exercises that we do is on the exhale. Because again, typically if we cough, laugh, sneeze, whatever we're exhaling is typically when that pelvic floor, if you have pelvic floor dysfunction, will go in the opposite direction. And that causes that pressure on the organs, it causes pressure on the pelvic floor, and it also can cause us to leak. And then, so one homework assignment I can give you for this is putting one hand on your chest and one hand on your belly and standing in front of a mirror or sitting in front of a mirror. I want you to take a nice deep breath into your belly and make sure that this doesn't rise. So kind of transitioning throughout the day. Throughout my day, am I doing more chest breaths? Am I doing more belly breaths? And then being aware of what you're doing and trying to implement like times throughout the day where you can check in on it. So it could be like a timer or a sticky note, but ways that you can check in on what you're doing. And then also if you catch yourself more in the chest breathing, think like, what emotion am I in? Am I stressed? Like what is causing me to breathe like this? More of these shallow breaths. And it could be a parasympathetic dysregulation problem. But these are like the best first steps, is just kind of to see what your normal is. And then also like, what is the cause? And then trying to adjust as necessary into more belly breaths. And then posture is very important too, because if we are in a wrong posture, this can also cause pelvic floor dysfunction and issues. And the reason is if we are slouched, so most of us today are in this C curve shape. You know, we're constantly like everything's on technology now. So we're on our phones, we're on our computers, or we're sitting and we develop this kind of posterior tilt slouch. And what happens is our pelvic floor muscles get tight when they're in that slouched position. So there are some people who we just shift their posture, and that significantly helps some of their issues. Because if you go into a slouch position and you try to Kegel, you will feel it more in the back, like by your tailbone or your rectum. But if we sit up tall and lean forward, kind of in front of our sit bones, what's going to happen is you're going to be able to optimize your pelvic floor reflex and those muscles. So when we set our muscles up for success in a right posture, they're going to be able to contract and relax even better. So they'll be able to turn on better. So kind of the best position to practice belly breathing and releasing tension and anxiety is sitting up tall and leaning forward and really just breathing down into your pelvic floor. And if you're standing, what I like to do myself and I like to tell my clients is go on posture walks. So, like pretending a string is pulling you straight up from the crown of your head and you're looking over a tall fence. And this is going to help turn on these deep little stabilizers that sit around and protect our joints. And when we're in this posture, kind of nice and upright and even just slightly forward, it's going to help our pelvic floor function better and optimize that stability and safety that we need in that area. It's also going to help a lot pre-pregnancy because what happens is I call it the mom posture. And after giving birth or even while pregnant, we will develop this kind of like slouch posture and standing where we hang out on our front of our hip flexors and we tuck our butt underneath us. So when we're holding a baby in that slouch position and standing, we are also making our pelvic floor tighter. But not only that, we're putting a lot of strain on our back. We're getting a lot of weakness and overstretching in our upper body, and it can just cause problems from your spine to your tailbone and kind of outward. So setting up in a good posture before we do anything is also really important. And these, you guys, are so foundational and so important to do